morning. So here are the exercises I've promised. The exercises are going to help with leakages, prolapse issues, post-hysterectomy, menopause and then postpartum, but also sort of tightness and gripping, SIJ issues, anything sort of along the back line where we find we're gripping all the time, it's going to help with that as well. And then obviously the whole idea is to work with the diaphragm and the pelvic floor to try and get that working as optimally as possible without dysfunction. So we're going to start on all fours. So coming into a tabletop position with your wrists underneath your shoulders and your knees underneath your hips, everything stacked. And we're just going to start moving backwards and forwards, just to release off any tension. You can then take this into any kind of like wiggle. So if you've got tight hips, you can do circles. If you find you're just tight everywhere, you can swing your bum from side to side. So just keep moving through those movements, doing what feels good to you. So just some tips for each exercise. So every time we execute one of the movements, we're going to inhale, preferably through your nose. So the most important breath is inhale in terms of nasal breathing, but if you can, exhaling through the nose as well is going to be optimal. The other tip is to have your tongue on the roof of your mouth. So throughout the exercise, it's going to help with your head posture and therefore posture of your body as well, which will follow suit. So we're going to start. I want you to take a look into a mirror. So we're going to take a look round to the side, and then we're going to round up. So we inhale through the nose, and then we're going to round up. So into the top of your t-shirt, it's the cat part, the cat-cow. And then I just want you to notice, did you need to shift back to get into that position? So sort of flagging up tightness. Do you find that actually there are spots along the back that you just can't round up into, and it's really tight in different areas? So the idea of this exercise, you can do it as many times as you want to, but we're going to get rid of the tightness from the inside. So we're breathing into those spaces. So we're going to come all the way up on a big inhale, and we're just going to focus that breath into the top of the back. So visualize where those areas are. I'm going to try and release them through the breath internally. And then you can exhale. You can come into the cow part if that feels good for you, just to decompress, and then just keep moving through the movements. But the most important part is to concentrate on the inhale, getting up into those spaces to release. Do a couple more times, inhaling in. So that's our first exercise. I would say that you need to do that at least 5 times. So our second exercise, we're just going to do a bit of an assessment. We're going to take our hands around the bottom of your ribs, and you're going to wrap them around. So we're just going to assess really what's going on. So the idea is that it's equal both sides. So if you're finding that you're restricted one side versus the other, then you know that's where we need to work. And that can be all the way around, sort of the back, so the mid-thoracic. So the idea is to inhale again through the nose. And you're going to squeeze, so your fingers should start coming together on your inhale. And obviously as you exhale, hopefully fully, then your hands will expand outwards. So your fingers will move away from each other. So this is to assess whether you can fully exhale. Because if you can't fully exhale, the pelvic inlet, as you take the breath in, it collects the air, so down into your pelvic bowl. And then as we exhale, that pressure should come up. So it's about pressure management. If you can't fully exhale, then that's when we're prone to kind of prolapses and leakages. So we're going to inhale squeeze together. Do you notice any side is worse than the other? For me today it's my left side. So what we would do is just focus on that area and work with that area, so through our breath. So we're going to go, inhale, try and get our fingers to meet, and then exhale. Really allowing that breath. Can we completely empty? So that's your assessment of your next exercise. Okay, so we assessed to see if we can do that full exhale. So we've done that, and then we're going to work towards looking at the infrasternal angle here. It's wider and narrower on different people depending on your anatomical makeup and genetics and things like that. But the idea is that we want, again, for that breath to be able to come down, be caught by the pelvic inlet, and then that pressure is applied back up so it fully empties, so that we don't have any kind of leakages or risk of prolapse. So if we take our hands around that infrasternal angle, and we want to make sure that your stomach is just fully relaxed, we're not engaging any muscles in the tummy, nothing around the back, and then obviously we're just, again, going to try and coordinate that breath, see that everything's working functionally. We're trying to release around the mid-thoracic as well, because if that's tight, it's going to throw up tightness in the shoulders and restricted neck movement and pain. So taking your arms, fingers even, around the infrasternal angle here, and we're just going to inhale deeply into the stomach without tensing, and we're just going to notice and keep the pelvic floor relaxed, and exhale. So that's as simple as it is. So we're going to inhale, and then just exhale. And that's the exercise. We want to fully exhale. So we can inhale, feel the expansion into that inlet, making sure that it's equal both sides. Keep going. Just letting it drop down into that pelvic inlet, and then just letting, hopefully, that pelvic inlet push back up. So it gives you that interoception into an awareness into the body. So then you can work with it. If you do notice that your sides, that one side is tighter than the other, then again you're going to breathe into that side, and we can find other exercises to work into that. So our next exercise, we're going to come onto our backs, and we're going to need a block. So we're going to come into a bridge position. So lying on your back with your feet hip width apart, you're going to have your chin slightly tucked down with the tongue on the roof of your mouth. You're going to apply the block in between your legs, and just have your hands nice and relaxed to the side. So all you're going to do is a glute bridge. So we need to engage our glutes. So when we inhale, we're going to engage the glutes to be able to maneuver up. And it doesn't matter how far up you come. And then as you come down, you relax everything other than squeezing the block. So we're going to be using the adductors as we come down. So it's very simple. It doesn't matter how high you come up, and you can work on it, and then you can increase reps, you can increase the height, but the idea is just to make sure that you're using the right muscles for the right things. So we inhale, squeeze those glutes to come up into your bridge. And then when you're ready, you're going to exhale your way down and let go of the glutes and squeeze down into the block. So we inhale up, release the block, squeeze the glutes. And then exhale down, release the glutes and squeeze the block. I would do this roughly 10 times. You can build up over time to 3 sets of 10. And exhale down, squeezing the block. So you can continue on and pause the video. Our next exercise, we're going to come into a side lying position. Come back here a bit, make sure I'm in the video. Okay, you can just rest your head into your hands. You're going to have your knees into a right angle with the hips, and then we're going to place that block on top, in between your legs. I will get the words out. So the arm is going to come forwards when you're ready. The idea is to create internal rotation of the hip, and we do that by, when we inhale, we're going to drag, or seemingly, so you can push down into the block. Our hand is here, and we sort of slightly pull back like you're trying to drag the block back towards you, and then we release forward on our exhale. So we inhale through the nose and exhale through the nose if you can. Have the hand out, nice and relaxed, or you can just place your head down so you're in an even more relaxed position. So we're just creating movement around the sacrum and the SIJ. So we're going to inhale, squeeze the block. It's a really tiny movement, and then as we exhale, we just try and maneuver back the other way. Inhale, squeeze the block, exhale, keep going. Again, I would do this 10 times if that's there for you. Just build up over time. Good job. Okay, so now we're going to come into a standing position. I'm probably going to have to adapt the camera so I chop my head off. Okay, so here comes the standing part. So we're still trying to create that internal rotation and eccentric lengthening, but you can progress and do concentric as well. So we'll start with the easiest side. You're going to need something for stability. Maybe it's a chair. If that's needed for you, we're going to take ourselves into a staggered stance. So the wider you have it, the more stability you have. If you want to progress, you can bring your stance in a little bit narrower each time. So the first stage, we're just going to chop ourselves in half here. So we come into a hip hinge. We're going to come forward, but we're going to have the tongue on the roof of our mouth so that our head is in that kind of neutral position. And then we're going to inhale here and just relax everything. And if that's enough for you, then we can stay here. If you want to, you could inhale and then just bring that leg inwards. So that's creating lengthening and internal rotation here. So that could be your first stage. If you want to progress, we could add a twist. So you come into a bit of a warrior 3 position. So we're going to karate chop ourselves here. And then we're going to inhale. You could take your arms out wide and then bring that knee and follow with the arm. So it's just going to add a little bit more lengthening. If you wanted to do both legs and you want to do the concentric aspect as well, we could inhale here. Come down to that first movement, bring yourself over, and then we could also come the other side, so it just adds a little bit more, and then swap legs. And then final progression, if you want to, this is a little weight, you can build up through the weights. So you could have your back foot on the floor. Mine's just not playing ball today. I've been riding this morning, my ankle's stiffened up. So we're going to come forward, we're going to hip hinge, keep our head nice and neutral, and then we could add a weight in. Pushing into internal rotation, just opening up at the sacrum, the SIJ. We could swap that the weight and bring it over the other way. Just adds a bit more challenge.